Welcome, everyone, to another episode of A Sister and Her Mister. Today we have Dr. Liz Lyster. She is an author, speaker, and renowned women's health expert. She's an OBGYN and the founder of the Miracle of Menopause Women's Network. Dr. Liz is a vocal advocate for women's health and offers personalized guidance and comprehensive wellness strategies designed to help women navigate hormonal change and reclaim their well-being.
Doctor said you got PCOS. Now go on, girl, just lose some weight. Till I took the symptoms into my own hands and reversed them naturally. So I became a dietitian to help my sisters feel the best they've ever felt. Take a step in my direction if you wanna prove them wrong and take control of yourself. Join a sister and a mister.
Welcome, Dr. Liz. Thank you so much for joining.
My pleasure. Happy to be here.
We're so excited. CDAC's not on this podcast today, but I'm so excited to talk to you about premenopause and menopause for women with PCOS and what that looks like. I personally remember when I was really struggling with PCOS, my gyno told me that my ovaries looked menopausal. I wasn't fertile at all. I had ovarian cysts. And that was like one of the terms used, which was super terrifying. She said perimenopausal or
Yeah.
premenopausal, but
Wow.
I know.
I'm so sorry that happened to you.
What does that even mean? We'll get
Even
into
I don't
it.
know what that means. That's not technical at all. So,
Yeah.
and to terrify you was just terrible. I'm really
I
sorry
know.
that happened to
But
you.
just because in that moment I wasn't fertile, doesn't mean menopause. That's like a state.
Yeah.
So maybe you can explain to the audience perimenopause and menopause and what a woman with PCOS should look out for and when.
Yeah, absolutely. I think the easiest way is to talk about it a little bit out of order. So, first of all, the easiest is premenopause, when everything's humming along, regular cycle, which of course a lot of women with PCOS are not experiencing. That's the pre. Then menopause is 1 whole year of not having a menstrual period. Average age is 51 years old for women. And then there's this long stretch called perimenopause. Peri, like perimeter, around the time of menopause. And it can be 10 or more years. And there is so much overlap between perimenopause and PCOS. So many of the physical changes that happen, including irregular cycles and skin issues and hair growth in the wrong places, weight gain, lots of overlap. So it's great that you're educating your audience so they can be aware and not have that terrible gaslighting experience that you had.
I know. Well, that's an interesting point because right now I'm 32 years old. So all I'm thinking about is fertility, making sure everything's good, doing my best. And beyond that, I haven't really explored what it's going to look like at 45, 50. My mom had early menopause, so probably earlier. So what do we look for during that? Is it called premenopause before menopause?
Yes.
Yeah.
Pre and peri come before actually going into menopause. And that, of course, doesn't address women who have their ovaries removed surgically. Then they're in menopause. They're surgical menopause, and that has begun. So everything that you're talking about, that we're discussing, is either pre or peri, depending mostly on a woman's age, I would say, but also what's happening in terms of symptoms.
Is there a connection between PCOS and pre and perimenopause?
Not directly, which is a good thing. It was interesting because there are conflicting studies on where does PCOS lead to. Does it lead to early menopause? Does it lead to late menopause? What I saw more was tending towards it happening a couple of years later. but the data are not consistent about
Mhm.
that. So there isn't a predictable connection. So if a woman has PCOS, it doesn't mean anything specific, like you're going to go into menopause earlier or later or have any other
Yeah.
of
Well,
those type of issue.
how do you know that it's premenopause when you've had PCOS symptoms your whole life?
Right? That's the important question. One thing that's really important, and I think that you guys emphasize this on your podcast, is advocating for yourself and getting the right care. And that includes testing. It
Mhm.
includes the hormonal testing. Unfortunately, doctors nowadays are in a big hurry. They don't have a lot of time to spend with their patients, and they may or may not be willing to do a very thorough panel of testing.
Mhm.
Right. So that really is going to be very helpful in differentiating the difference. So
Yeah.
there's certain blood tests, hormones that you measure, especially the brain hypothalamic hormones, the FSH. FSH is the single main test that helps us say, is a woman completely in menopause? The FSH goes up,
Mhm.
right? But with PCOS, there's also another brain hormone, which is the LH, the luteinizing hormone, and those, depending on the ratio. So it really requires advocating for yourself and having a doctor or nurse practitioner or provider who's willing to do the deeper look.
Are those the main hormones that they would look at, FSH and LH? Or do they also look at progesterone, testosterone? Does that change
Yes.
for menopause?
Yes, absolutely. So basically, if you picture that when we're young, like around our 20s, right around age 20, a lot of different hormones are really at a peak. Everything's just functioning at high level. We have good thyroid hormones, adrenal hormones, hopefully, are in good shape still. The sex hormones that you're talking about, and of course, a lot of other ones that you talk about, okay, insulin, all of that is really, really important. And so we can get away with a lot in those young ages. And then later, what tends to happen is this general decline. Okay, I know your audience can't see me holding up my hands, so I'm kind of holding them up high. And then there's this general decline. However, women, for example, one of the first hormones to decline for us women is progesterone. That is a chicken and egg with
Mhm.
irregular cycles. Then the estrogen starts to decline. And then we go through this up, down, up, down. I call it the stock market phase. So if people picture like a sharp up and down, and then eventually our ovaries do go into full retirement, and then everything is low.
Mhm.
Testosterone is doing kind of a steady decline all that time.
Okay. So
Mhm.
women with PCOS who have high testosterone most of their lives or
Yeah.
young lives would see a decline in testosterone before
Yes.
menopause.
Yes.
So would that help with symptoms?
Yes. Yes, it
Do
does.
things get better?
It's
Is that what you're saying?
Yes, yes, that is what I'm saying. It's like, yay, to look forward to. So, yes, so as the body changes, the ovaries change. This was so interesting that about 30% of women with PCOS, as they go towards menopause, their symptoms will improve. They will end up with regular cycles. They'll develop regular cycles. Okay. I know. It's very,
Okay.
very interesting. Yeah, and as the ovaries get smaller, there's fewer of the follicular cysts that are part of the definition of PCOS. As that happens, things can improve.
Well, that's great to know.
Yeah.
On the other hand, I'm thinking of all the metabolic issues we struggle with PCOS. So if PCOS goes unmanaged for a long period, you just don't manage your PCOS, then you hit menopause. Yes, your testosterone goes down and symptoms could get better. But then the insulin resistance, the root cause of PCOS, the cortisol, everything, if that goes unmanaged, it doesn't get better later on.
That's
So it's like
exactly
a
right.
double-edged sword. Like you can look forward to it, but also like you could also get
Yeah.
diabetes. You could get so many, high cholesterol, high triglycerides. Your
Yep.
metabolic panels can get worse and worse. So
That's
the,
exactly right. That's why
the
everyone
picture is
needs.
still not good.
Well, luckily, people have your podcast to listen to. You have so
Yes.
many episodes with so much education, so many different
Yes.
experts. And I think that your audience is already a great self-selected group because they're people who care, who want to advocate for themselves and do those steps. What you said is so correct and so important because for example, a woman with PCOS who does not address those underlying issues, who doesn't do the hard work of improving her metabolic health,
Yeah.
she is putting herself at higher risk because she's doing two things. She's getting older. There are other things that contribute to getting older and having, for example, more cardiovascular issues as we get older. But a lot of that is correlated with waist circumference, insulin resistance, onset of type 2 diabetes, for example.
Mhm.
So doing everything that a person can do to address that and fix that ahead of time is doing herself a huge, huge favor from a health standpoint.
Yeah. And then when the menopause time starts to come and the testosterone starts going down, then it's kind of a relief.
Exactly, exactly. And by the same token, we've got to be careful, right? Because women, for example, with less testosterone might feel a little bit lower sense of well-being. Testosterone helps with mental sharpness. It can help with libido. It's not the main determining factor, but it can definitely help with that. So everything in life is a bit of a balancing act, and
Yeah.
that's especially important when you already have a metabolic concern, because I consider PCOS primarily a metabolic issue. Even in my training, I was in medical school almost 40 years ago, which sounds really insane to say out loud, but it's true. And it was very old fashioned at the time. If you didn't have PCOS, if you didn't have cysts that we could see on your ovary, but we know so much more now
Yeah.
and how important the metabolic side of it is. And so getting all of that in order ahead of time is going to make a huge difference.
Oh, absolutely. Zinc, vitamin D, magnesium, B12, these are all the vitamins that we're deficient in because of PCOS, and the list grows on.
If there was only a way to get all of these into one supplement bundle without going on a massive online search.
Hello.
What?
Isn't that why we created Metabolism Plus?
Oh, you mean our supplement line that covers all the nutrients and vitamins a woman with PCOS needs in one bundle?
Yes. Sisters, when I was diagnosed with PCOS, I was so overwhelmed with researching all the different supplement companies, and eventually I had a huge collection of bottles in my cabinet that I couldn't even keep up with.
So, with that in mind, we created a bundle of 4 essential supplements that have the fundamental nutrients for women with PCOS, and it's called Metabolism Plus.
Not only does our bundle include omega 3, coenzyme Q10, curcumin, but it even has a multivitamin designed to fill nutrient gaps that are common in women with PCOS.
And what makes it really special is that all of our supplements are NSF certified, which means they are third party tested for purity and accuracy.
Head over to ovafit.org to order your Metabolism Plus bundle today.
That's ovafit.org.
Okay, stop smelling. The link is in the description.
How dare you?
Also, I wanted to talk about progesterone and progesterone replacement therapy because a lot of women with PCOS are offered this due to having low progesterone and high testosterone. Then when you get into menopause, perimenopause, is that something that's also offered?
Yes, absolutely. My approach with my patients is I use the word holistic because I'm looking at all of her. I'm looking at the whole person. I take care of men as well, about 10% of my practice. So it's mostly women. And I have women of all ages, mostly in their 40s and 50s, but I am seeing women younger and younger because of the hormonal impacts of our environment and our food and all the things that you talk about a lot. So going into this whole time it's just so essential to do whatever we can do to be as healthy as possible heading into it. So with the treatment approach, so I do very detailed blood work. Sometimes I'll do urine or saliva testing, but I often start with blood work because people can have that done on their insurance. I don't bill their insurance, but they can have labs done on their insurance. And then always a very comprehensive approach. So, as you mentioned, progesterone's very essential. Also, thyroid, really, really important. I say this to patients all the time, and that is that any woman who has an issue with her cycle, whether it is PMS, PCOS, anything related to that, there are two hormones that are really important to look at. One is progesterone for sure. So let's say more about that in a second, but also thyroid.
Mhm.
Those are very, very important.
So about the thyroid, well, I wanted to go back to the progesterone as well.
Sure. Yes.
When you have that checked and you do the replace, basically I guess that what I'm trying to ask is that something a person will continue to need from PCOS through menopause? Like with a woman with PCOS might need?
The answer is it could be, and that's okay.
Mm-hmm. Mm-hmm.
All of the information that's out there that is scaring women away from using bioidentical hormones and using them the right way in the right doses, all of that data is based on the wrong hormones, the wrong method of using the hormones. Okay, so luckily, progesterone has been really out in front
Mm-hmm.
in terms of bioidentical. Very important that it be bioidentical, which all that means is that it's the same as what your ovaries used to make enough of, hopefully,
Mm-hmm.
right? Women with PCOS have a special challenge in that area because of the ovulation dysfunction. That's why. All
Yeah.
right. So luckily, there's a lot of bioidentical progesterones out there. They're easy to get. Everything that you can get over the counter is very low dose. And I am a fan. I'm a fan. I recommend it. It really, I'm, again, not to dispense medical advice here, but really, it kind of can't hurt anything. The most it can do is women can feel a little sleepy because it calms the brain.
Mm-hmm.
That's about the worst that can
Yeah.
happen.
My mom takes she has like a patch, like a hormone patch. I think it's progesterone or something. But she swears by it. She literally hasn't aged. Like she's like almost 70. No one can believe it. She's been
Yeah,
taking it for
good.
years because she had
I
early
love that.
menopause. I also really think that that's helpful, and I've heard a lot of doctors and functional doctors even, recommend that as a treatment because listen, like you can make all the lifestyle changes to get your body to ovulate and produce progesterone. But I think sometimes when it comes to genetics, it kind of holds you back and you might not be able to produce enough progesterone, right? And then you can take progesterone and it's fine, you know?
Yes. Well, this is the part where I always have to admit my bias, which is that I love hormone replenishment.
Mhm.
Again, when it's done the right way, and women really don't have to be afraid of hormones. So what I heard what you were just talking about is what it made me think of is one of the things I say to women, which is unlike other functions in the body, for example, adrenals. Our adrenals can get tired, but we can help them and then they can feel better.
Yeah.
Whereas we can do things to help our ovarian function as well. But eventually, if we're blessed and to live long enough, we will go into menopause and our ovaries will go into full retirement.
Mhm. Mhm.
And then we have another modern problem, which is we live so long. We live a long time, right? Like you're so
Yeah.
young. I'm going to be 60 next year, so I'm
Oh
excited.
my gosh, you look
And
great.
thank you. So getting ready for that and then getting ready for hopefully like as many decades after that as I can,
Yeah.
right? And so progesterone can be helpful, a little bit of estrogen. I'm gonna guess that the patch that your mom has might be an estrogen patch because that's a good way through the skin is the right way to use
It
estrogen.
might be,
And yeah, and progesterone needs to be bioidentical. Those are like two little pearls because your audience, as we were saying, is the very proactive
Yes.
and want to be ready for the long game.
Is progesterone given in the form of cream or like a pill? Because I've
It
had the
becomes
cream.
Yeah, it comes as both. Over the counter, to my knowledge, it's only available as a cream, which is fine. A lot of women do well with that. So you apply that anywhere with thinner skin. So inner wrist, belly, inner thigh, those are usually a good way. And you want to give it a really good rub. And that way what it does is it goes into the fat tissue under the skin, and then it circulates from there.
Do you think that should be part of like our routine as women with PCOS, or is this more specific? Go to your doctor, figure out if you actually need it.
I would say more B. I live between two worlds. My parents are both retired doctors. They're both doing great in their 80s. But I also spend a lot of my time in the more holistic preventive medicine arena. So I'm kind of between the conventional medical world and the other side's like the preventive medicine, and look at the root cause and that side of the spectrum.
Mhm.
So I'm always balancing between those. But my approach, I do like to do the testing. I definitely encourage women to find someone that you can work with who will order the testing. Nowadays people can do so much on the internet. People can go
Yeah.
order their own blood tests, but eventually a lot of people end up coming to me after doing a lot of stuff on their own because they couldn't get the help they needed.
Yeah.
So hopefully, if each of our listeners can find someone to work with over the long run.
Yeah. I mean, it's like a science project. Figuring out your PCOS, you almost need a degree by the time you're done. And like you have to understand the root cause. You need to understand what your environment is doing or the food you're eating is doing and triggering. And just how does blood sugar work? I mean, we try to break it down in the podcast and empower people to feel stronger about what they can do for themselves. Um,
Yes, I think you guys do a fantastic job doing that, by the
Oh,
way.
thank you.
Yeah,
Thank
absolutely. So just to say, and to kind of alleviate if someone's getting all worried about it, is that a phrase that I like is that for myself as a doctor, I have the body of knowledge, but you have the knowledge of your body.
Mhm, mhm.
So you do not need to learn all the science, but you do need to learn what applies to you.
Right.
All right. That's why I really like your format of shorter podcasts, lots of different people to learn from, and to look through the episodes to see what resonates. What issues are you working on specifically in order to feel your best? Because that's definitely my motto
Mhm.
is thrive at every age, feel your best so you can go out and do your best. And people don't have to tolerate feeling anything less than that.
Absolutely. I love that motto. I totally agree with you. There's no reason to suffer. We can figure it out.
It is a lifetime project, that's
It's
for
a lifetime
sure.
project. You're
It's a
gonna see.
lifetime project. Yeah.
Women change
Yeah.
so much. I don't think men change as much as we do. We're going through
They
all these
don't.
different
They
hormonal
don't.
phases. Every
Yeah.
week is different. One second you're creative and you're so good at your job, and the next second you're like PMSing and the world is like coming to an end. Like what?
I know, the poor guys, they're looking at us going, "Okay."
Yeah. And
It's exactly we're changing all the time, up,
I
down,
know.
up,
And
down.
I honestly like, I think right now, maybe I'm ovulating or something because I feel so creative. And like last night, I couldn't sleep. I was designing something for our app. I don't know. I was just going really like nuts and I rode the wave. I didn't stop myself and like go to bed early or whatever. And I was like, it is what it is. Like, because I know I'm going to start my period in a week or
Yes.
so, and I'm not going to have this vigor. And this
Yeah.
job is not going to get done. So I need to just,
Beautiful. That is so inspiring. That is exactly what I mean by knowing yourself, knowing your body, knowing what's coming. You're planning, you're being proactive. Yay, yay, you.
yeah. Oh,
Awesome.
thank you. So
Mhm.
tell us about your book. I see it right next to you over there, next to the
Yes,
flowers.
this is the book. I've written a few books. The Miracle of Menopause book is coming. That one is kind of on the runway. This one, yep, that I've got right here. This is the one that I have as a gift for your audience. This one is Go for Great, Dr. Liz's Guide to Thrive at Every Age. And GREAT is an acronym, stands for gain knowledge, realize the truth about hormones, explore your expectations, advocate for yourself, and T is for thrive. So thriving at every age. So this book really is for all ages and is really going to help people be armed and ready for riding the waves as they come of going into perimenopause and then menopause and still being able to feel fantastic. That's my goal for everybody, but women especially.
Oh, that's awesome. I love the title you chose because, you ask someone, how are you doing? I'm good. Let's go for
Right.
great. Like, let's take it to the next level.
Yay. Yes.
Yeah, let's thrive. So what are some of the, wellness strategies that you recommend for women? Maybe you can share with us what's in a little excerpt from the book or like whatever is in the book.
Yes, absolutely. Oh my gosh, there's so much in here. One thing that's important is that while I said I love hormone replenishment, we've got these high levels in our 20s and sometimes in our 30s, and those decline as we get older. And we don't have to replenish all the way back to those levels. It's not about staying 20 forever, but it's about feeling good. So that is important. And you cannot out hormone lifestyle. So all the important choices, doing what I call the harder work, which is looking at what you're eating, doing everything you can to optimize your health. You got to go past what doctors are going to help you make sure you don't have diseases, but they may not help you really get to your best health. So
Mhm.
that's really important, optimizing rather than just normal in quotation marks, where the doctor will do a couple of tests and tell you everything's normal in quotes, but it might not be optimal.
Mhm.
So that's really an important concept for everyone to keep in mind so they can really advocate for themselves. Another strategy is being very wary of scary headlines. Scary headlines tend to talk about relative risk versus absolute risk. So there can be, for example, double the risk, but really it's still a very tiny chance of it happening. And
Right.
that's very, very important. I love to plant that idea in your younger audience to know about that forever.
That's a
Okay.
great point. There's so many triggering headlines and
Yeah,
ways that people manipulate research studies to have
exactly.
outcomes that benefit them or put money in their pockets. And when people are like, show me the studies, I'm like, I'll show you the studies, but like, which one are you going to trust?
Right.
Because like,
Right.
you need to test what works on your own body.
That's
Um,
exactly right.
yeah, there's a lot
Yeah.
of, especially in the PCOS world, like there's just a lot of what's misinformation.
I can imagine. I can absolutely imagine because a lot of doctors don't know that their depth of knowledge with hormonal issues is not as great. In our medical world right now, if you have something really straightforward, you need your appendix out or you broke a bone, pretty much people who come out of medical school know those important
Yeah,
treatment approaches. But when it's more subtle, more nuanced, way more moving parts, especially for us as women when it comes to hormone health, is
yeah,
to keep looking. Don't accept I call it the J word. You just have to accept what's happening. It's just part of your diagnosis. And I encourage everyone to absolutely reject the J word.
reject. Oh my
Yeah.
gosh, I love that. Yeah, I definitely had multiple doctors tell me it just is what it is without any further explanation. And it's if I could go back and like be that doctor and say what should have said, what they should have
Yeah.
said, I
Yeah.
would have been like, hey, your blood sugar really affects your hormones. Maybe you should think about changing your diet in this way or that way, or talk to a dietitian because this can really have an impact. And PCOS is a metabolic issue instead
Yes.
of this is just your genetics and it is what it is?
Yes, yes. One more that I would add of the I don't know how many zillion things I talk about in this book, but the E for explore your expectations. We live in a world of quick fix,
Hmm.
trying to sell this this one thing is going to make all the difference for you.
Yeah.
Right? Whereas we know that's not true. We know that you've got to work with professionals like you. You've got to really take a careful look at what works for you, what doesn't. And it's a lifetime project. It's not something that's one and done.
Right. It's a lifetime project and you can't put it on the back burner, and things can get out of hand if you do, because years go by really quickly. The days are long, but the years are short. The
They
next thing
are.
you know, it's been 5 years and you haven't managed your insulin resistance. And, things can get hectic later on, even around the time of menopause.
Yes, exactly. Which is, again, why your audience is self-selected and definitely ahead of the game.
Absolutely. Yeah. I feel like the people that come to our account are so motivated and just
Yeah.
yearning for that knowledge because they want to
Yes.
go beyond what they were told in their 5-minute doctor appointment. And they're
Yes.
looking for doctors like you and books to read and like ways to nourish themselves and feel more empowered and thrive rather than just be
Yeah.
all right.
Yes. Exactly.
Thank you so much for joining me on the podcast, Dr. Liz. Why
My
don't you
pleasure.
tell our audience where they can find you?
My website is the central place to go. So that's drlizmd.com, drlizmd.com. People could write to me. They can ask me questions. They can talk to my team. They can get on my newsletter that I send from time to time. They can be on the waiting list for the book. They can see articles. They can read and listen. And it's kind of the central hub
Oh,
for
that's awesome.
everything.
And do you do virtual appointments?
Absolutely. Yes. I have people all over the country. I've had people outside of the country. Yep, I sure do.
Oh, that's wonderful.
I do
Okay.
both.
Well,
Yes.
thank you so much for sharing. And we'll definitely leave the link for your book in our description for our audience to take a look and read it. Thank you so much for sending a free copy to our audience. And we are
Welcome.
just, I keep saying we, I'm used to CDOC sitting next to me.
I know.
I'm just thrilled to have had you on our podcast. Thank you so much for joining.
My pleasure.
Hey, sisters, just wanted to let you know that all of our podcast episodes have corresponding blog posts that dive deeper into each topic. So head over to PCOSweightloss.org/blog.
Is it slash or is it backslash blog?
I don't know.
I've always heard one or the other.
It's /.
Or slash? Just in case, you can also go to PCOSweightloss.org.